So I'm sure everybody heard that. So we're having a little bit of technical difficulty getting Mike on the line, but we will resolve that issue. And again, this is Betsy from MCOA, and I want to welcome everyone this afternoon on this very warm day. Want to thank everyone for joining us. We have the folks from AARP, and David will introduce Mike and Kara Cohen and their other colleagues. And so, David, I'd like to open it up to you to do the welcome. And also, we have with us, and my apologies, we also have Carol Malone, the Assistant Director from Elder Affairs. So, David, would you like to make some opening comments today? So, David, I don't know if you have yourself on mute, but I'm not hearing anything come through. So, if you want to unmute, if that's an issue.
There we go.
There we go. Great, thanks.
Sorry, I had another call that came in at the exact same moment. Welcome, everybody. Thank you for joining us again today at our statewide forum to discuss some of the issues that have happened over the last week. I continue to remain hopeful. I'm pleased with the progress that many local councils on aging and their regions and the state have made over the last week, and we want to share some of that great news today to keep the momentum going as we build towards reinvigorating, reestablishing, reopening our senior centers. At this point in time, all senior centers should be closed. When we review what the governor has shared with us in terms of the plans, and I'm sure Carol will cover this a little bit more, but the Safer at Home plan that came out a week ago Monday, it is online. You can go read it if you need to. Specifically addresses people who are over this age of 65 and older, and people with pre-existing conditions to stay at home and be safer at home. There also are plans in there, guidelines in there that specifically limit any large gatherings. It's now 10 or under. And those two prerequisites, those two governing principles and protocols that are in place, to me would rule out opening any senior centers in the near future. But I just want to remind people of that is what we're governed by. And when you have this conversation with your local board of health and your town managers, that's the protocols that you'll need to address as we look for eventual lifting of those and or relaxing of those, so we can think about what our senior centers look like. Having said that, there is so much to do between now and the time that we begin to open our doors, and I use the word begin to open our doors specifically. And I would suggest that many of you start thinking about those tasks and starting to implement them in your senior centers, because there's work that has to be done. Some of you have not been in your senior centers since you were sent home back in mid-March. Some of you have been there, have had one staff on site throughout this process. So again, as you go back into the office, when you start to look around, I would stay with the suggestions that we've had in the past. The concept of the task force, and it will be releasing, Betsy will talk a little bit about this, hopefully sometime in the middle of next week. I want to thank the 3 students who came up with the guidelines along with our team that helped guide our team, Becky, Betsy, Tara, and Susan, and the rest of you that provided some input into this. I think it's important that we take a look at these recommendations and how they implement at each senior center. I remind all of you that that axiom that we've used in the past will govern this as well, which is you've seen one senior center in Massachusetts, you've seen one senior center. You're all built differently. You all have different amounts of spaces and offer a variety of different activities. So what might fit in one town probably won't fit in another, and each of you is going to have to design a plan that fits within these guidelines and fits within your town and what your Board of Health and town manager want. There's some discussion as a follow-up, and we'll be posting that plan, but we'll also be posting local plans for people. Some of you have already come up with plans and we want to see them so we can put them up there so people can use them as references. Again, so we don't have to reinvent the wheel, but we might be able to adapt what you have put together on paper so other people can see it. Kathy Bowler has found a great recommendation from North Carolina, and we appreciate that. That state has a very comprehensive plan. We will be posting that as well, and that's something to take a look at. Again, these are resources for you to review and to read as you develop your own local plan. Last week, there was a lot of discussion about, what do you need to consider regarding reopening? And I had actually the week before mentioned about taking that inventory in your building. Lots of times we don't stop to pause. We're trying to add so many activities and do so many things that we never take a full inventory of the different things that exist and what our building is like. And I suggested taking a staff or two and just walking around your building from that first moment you enter the building to the time where you turn off the lights and lock the door. What happens within that building in what space? To take a look at and list those activities. And list the location in the center, or if it's off-site, put that as well. To talk about whether it's a formal or informal activity. Many times a group of people might just get together and have coffee in front of the cafe, and you do need to list that because, again, it is interactions with people. What's the average participation for that activity, whether it's a Zumba class or helping somebody get on food stamps? What is that participation? Put a number there. Put that range that it might be. A Zumba class might vary from 12 to 20. If you have to, put a range. And then talk about the exertion level as well. Is this a low exertion? Is this a moderate? Is this an intense exertion? And the reason that that's important is, again, this is a virus that is transmitted by breathing. So if you're sitting down playing cards, you have a certain breathing pattern and your droplets that are coming out of your mouth are minimized versus a Zumba class or any other type of aerobic activity. So I would put that in, factor that in as well. And then when you sit down with your town manager and your public health people, you can talk about this chart that you've created now with all these activities, the size of those activities, the intensity of those activities, and then you can take a look at that and decide when you want to reopen that activity. You don't have to reopen everything at once. You might start small with small group activities, and then as that number of 10 increases back up to 25 or whatever, we can then think about layering on more activities. So this shouldn't be a Monday we're opening up the entire center. This is a partial openings, reopenings that we're talking about, and that's what I would suggest you'd be thinking about. I got a great forward from Grace and Randy at our Callahan Senior Center in Framingham. They walked around with a 6-foot dowel to see what that 6-foot distancing would be and where the bottlenecks would be within their senior center. And do you have to create one-way hallways that people go down just like we do in the supermarket, so we keep people at safer distances? Those are the kind of things that you can be thinking about now while we await the future green light to begin to open our senior centers. But where are you going to put a sanitation station? Where is sanitation going to go up? How do you clean, as Betsy talked about last week, all of those touched surfaces from the My Senior Center to the doors, to the bathrooms? How are those going to be cleaned? How often are they going to be cleaned? Those are the protocols that you can begin to take a look at now, because it's important that we make sure that that is you have those on paper ready to go, so when the green light is given, you can hit the ground running. So keep those in mind as well, because I think it's important that there's a lot of pre-planning that's going to need to go into any reopening exercise. I know there was some pushback, some feedback, some comments about some of the stuff that's in the Safer at Home piece, specifically around masks and social distancing. I just want to reaffirm that I believe fully in the administration and what Governor Baker has shared with us. I think they're spot on when you look at what's coming out of CDC and the rest. I know there's some different voices on this, but when you look at governors from both Democrat and Republican governors from Ohio and Maryland and New Jersey and Pennsylvania and California and Michigan, they're all on the same page as our Governor Baker. And they're talking about social distancing and masks. We even see Nancy Pelosi and Mitch McConnell, who agree on very little, agreeing on both of those principles, that we need to be wearing masks in public, especially when you can't socially distance. And even someone like Sean Hannity was on TV talking about the need to properly exercise your contact with other people, because we do not want to spread this virus anymore. The more we spread this virus, if we were to have a second phase, a second wave of this, that will hurt the economy even more. So let's be careful. We are now on Heartbreak Hill on the marathon. We are so close to the finish that you can begin to sense it. And we will be in back to what will be a new normal. But this is not the time to stop and have a cheeseburger. This is a time to keep trudging up that hill, keep these protocols in place, because it's really important that we try to keep as healthy as possible as a community. The second thing that came back was contact tracing, and I know that we introduced that topic somewhat successfully last time, but it's a way to make sure that you in the human service field understand the public health field. They're going to want to track anybody who comes in contact with COVID patients, and how is that happening? My Senior Center is one tool. There's some privacy issues around that that concern all of us at MCOA, and we will be forming a small group of people to review any policies that have to do with contact tracing in senior centers. And if you're interested in that, please get back to me and we'll make sure that you get invited to those meetings. But the one way to prevent this illness from respreading, having a second outbreak, a second wave, is to be able to close down something very quickly. So if Mabel has gone into the senior center and Mabel tests positive the next day for COVID, we can contact all the people that she was with in the senior center to make sure that they are aware that they might need to quarantine for 10 days, 14 days to make sure that they're okay. So that having been said, I think that we are looking at, in terms of reopening, that there are a lot of great groundwork has been done, that there's a lot of good reference material that will be being posted online over the next week that you should be checking out, and working within your team locally to develop your own reopening plans. The second thing that I wanted to mention about this was the discussion that's happening through the Mass Budget Policy Institute, and others that are talking about this recession and what this means. It is way too early right now for us to project what's happening with the state budget. My early conversations that have happened this week and will be happening next week with their leadership, nobody is willing to even say when the budget will come out. So we won't know what our budget is in terms of a formula grant, in terms of the other elder affair line items, in terms of local aid, probably until late summer. So we're going to have what's called continuing resolutions, which are a monthly add-on that they will add a month to the FY21 budget. They'll put July down as spend 1/12, and we'll continue on that until we get a better sense of what type of local aid, what type of state aid will be coming from the federal government. So there are talks about things that I just want you to be aware of. 4 letters, and this is, if those who took economics 101, these were the 4 letters that had to do with recessions. Recessions were a V-shaped, a U-shaped, an L-shaped, or a W-shaped. You always hope for a V-shaped recession, which it goes down quickly and then back up again. Most people have felt that that is not going to be happening this year. This recession is not going to be a V-shaped model. That'll be more like a U-shaped model, where we're going to go down, be down for a period of time, and then gradually go back up again. That's similar to the L-shaped model, only the going back up again doesn't happen for a couple of years like it did back in the Great Recession. What we all hope to avoid is the W recession, which has happened in my lifetime here at MCOA, where you've gone down, you've gone back up again, and then you dropped again because the economic safeguards were not in place. So those 4 letters, V, U, L, and W are models of recessions that we're following. We don't know if we're going to be following which one of those, or will there be something completely different. Somebody suggested the Nike swoosh as the model that we're in, or hopefully we'll be in. But we'll see how that progresses. But the early word is that this is not something that will be cleared up by November or next year, that this is going to be a longer term recession, and you should plan accordingly for that. Having said all that, that's what I want to share now, but I'm going to turn it over to my good friend and friends at AARP who've been working with us on many different issues, including a quick sidebar on social isolation and loneliness, and I commend them for taking the lead in that project statewide. But the other thing that we're interacting with them now on is the AARP Tax Foundation, and are we going to be able to somehow bring that back to our senior centers before the July 15th deadline? Mike was on a couple of weeks ago and gave us an early preview of this. Mike, I hope you're online now and can hear me.
I am online, and I'm even sharing a video, but let's just say I'm glad I'm on. Appreciate the opportunity. I want to give you a shout out again for all the work you're doing. And just as a footnote on the various letters of the alphabet that describe what we're dealing with and might be dealing with in the future, ARP, as you know, is a strong advocate on the budget side of things, and whatever the state budget's going to look like, whatever the issues are that impact particularly local aid and local programming and MCOA priorities, we're going to be hand in hand with you. We'll do whatever we can to be helpful. On the matter at hand, rather than hear from me or Kara, even more than I, is very much engaged in supporting the tax aid program. I thought it would be best for you to hear directly from the two people who are intimate with this program. One is John Woods, who is now the regional director for the tax aid program, and formerly the Mass director, and also Joan Gong, who is the current Mass director. Both of them have been directly engaged with the foundation, working on dealing with all of the the challenges that are facing us, including councils on aging and people on this call, on whether and how we reinstitute the tax aid program. So without further ado, I'd like to ask John Woods to start this conversation. He understands what is on your mind, and he's able, with Joan, to, I think, address the issues that are of concern to you. So John, if you would be kind enough to tell us what's going on. Is John on?
I'm just checking. This is Betsy. So I see I have Kara, excuse me, and I have Joan on. But I don't.
Well, I'll tell you what. Why don't we go to Joan, because Joan is the state director and she's been in touch with John on a regular basis. So it's perfectly fine to let's have Joan have at it. Okay.
Great. Joan, you're up.
All right. There are ongoing discussions, even as we speak, with the regional directors of tax aid, with the national leadership, up through AARP, as they're trying to decide if, how, and when we can reopen. As of this morning, I don't believe they had come to a final decision, but they are still assessing the risk and determining what's the appropriate course of action.
Now, Joan, in terms of dealing with the current tax aid volunteers, could you give a sense of how that's been going in anticipation of the best scenario, which is some semblance of completing the tax season with volunteers?
I would estimate right now that maybe some fraction, could be less than half of the sites could possibly reopen. Some just physically don't have enough space to be able to do so. And in some cases, the volunteers are not comfortable doing so. But maybe around, I would say roughly half right now, a third to a half, could possibly be willing to reopen. depending on agreement with the site, of course, because some sites are not allowing right now any reopening talk. So that's about where we stand.
Okay. And is there a sense of when the final decision will be made by the foundation? I know it is a day-to-day matter. In fact, you and I and John talked about this late yesterday afternoon. And, you know, it is, I think for those on this call, clearly the certainty around this is what we need to get to. And if you can give any sense of what that timing might look like, I think it would help.
The decision, as far as I know, was supposed to be made this week.
Okay.
But I wanted to mention one thing, that we are going to be putting out some guidance to the people, to our volunteers, to get out to the taxpayers. I know there's a lot of panic about this July 15th date, and that is the tax deadline. But for many, many, many of our taxpayers who do not owe anything, that deadline is not really a hard number. They can file at a later time without any kind of penalty. So what we're going to do is get out to all our volunteers so they can pass that information out to the taxpayers. It means the taxpayers have to have some understanding of their own personal situation, but it's not the IRS is not going to come after the vast majority of our taxpayers because they don't owe anything.
Understood. I don't know if there are any questions, David, from you or Betsy, anybody else that would want to. I know what, you know, the ask was, but this is apparently the best we can get for information at the moment. And I will say this, I mean, clearly once that final decision is made, and it really is a matter of days, we can share that information directly, you know, via email to you and to all of your people, so that there won't be any delay. We certainly wouldn't have to wait for another call like this.
Great, Mike. I appreciate you and Joan and John and the work you guys have been trying to do to make this happen. I think what's important for our folks to understand is those who have hosted in the past.
Right.
You are unable to host because of the town protocol or your ability to open your senior center. You should make sure that Joan and your person that comes on site is fully aware of that, so they are not planning to staff up something that may not be possible. If you have specific requirements as to what that would be, again, I would suggest that you talk directly with your local person who comes on site to do the preparations, to make sure that if they have local issues that they need and you have local concerns, that those two have talked through before the green light is given from the foundation to move forward. I think that would help us then begin to identify those communities that this service, which we've used, is an incredibly valuable service. We thank ARP for doing it, but for this year, it's not going to be available in community Y because of you know, the lack of availability of a volunteer or lack of this, that we know that, so we can get that word out to those older adults who had signed up, who have wanted to sign up, so they can start figuring out their alternatives. I take exactly what John said, that the number of people that we need to worry about are the people who actually owe taxes, to make sure that they do file by that July 15th deadline, and how we triage them and get them into either directly into an ARP volunteer or into an alternative is something that we should be working together on as a team. So from my end, from my members, I would suggest that you get into contact with either Joan directly or with the local person and talk about the concerns that you have, and start identifying on that list of people that are left to have their taxes done, which ones need to be on the priority and which ones could wait for a longer date.
That sounds good. Now, I just noticed that John is in fact on the call, and I'm not sure if there's anything he might want to say. If we have a moment to do that, David, I'd appreciate it.
Hey, John, great to hear from you again. Come on, we've got to get you unmuted and join us.
Hi, David. How are you today?
Good to see you, my friend. Or not, wish I could see you, but any updates from the national, from the regional that we need to worry about? Joan has provided some information. Mike has provided some information. Please share with us, my old friend.
Okay, no, I'm happy to do it. Are we ready to go for everybody right now?
Well, we just finished pretty much most of it, but I think the key here is that if there are things you want to say or add because you've been in direct discussions and there's protocols and all of the details around possible opening scenarios are what you've been working with. So assume that we've already given them the bottom line, which is that a final decision with the foundation has not yet been made, and that clearly that it's important for individual COAs and senior centers and locations and communities where they've done it, that they've got to coordinate this with Joan and with the local volunteers in any event. And that's all being teed up. But suffice to say, I think from your point of view, John, you may be able to give additional insights to guide the thinking of the group.
Yeah, no, I had envisioned it, and I sort of had probably a 4 or 5 minute summary. I'm afraid I'll duplicate much of what you all said, but maybe I'll just start to run through that as quickly as I can. As I think Mike probably introduced before I got on, I'm John Woods. I'm the regional coordinator for Region 1, which is New England overall. And for just reference, I'm a volunteer. After me, it gets to be a few paid staff in Washington overall. I'm ready to go. Our volunteers are ready to go, significant numbers of them. I think the national office is almost ready to go. I also wanted to comment that we partner in Massachusetts with perhaps 100 senior centers across the state. We really value that. And I want to apologize a little bit we've worked closely with you for forever, and I wish we could be working a little more closely than we have over the last week or so. But I think that's going to get solved in the next few days in interaction with the national office and overall. So let me give you a little background. About 2 weeks ago, the national office finally realized they couldn't plan a single national opening date across the entire country. And they created a committee of 6 people to make recommendations to senior leadership on how to delegate that authority to do the opening. 1 week later, a week ago today, that committee submitted recommendations to the national leadership of the committee, but also to the sponsors, to the IRS and to the AARP leadership. We were promised comments back yesterday, and we got some comments, but it wasn't entirely satisfying. There were some very minor comments on the plan, and they asked that we resubmit it, which we did. I believe that in part was to give them another day or two to think about this, because like all of us, I think they're deeply concerned about situations where people could be at risk and bought a little time. We've been told they'll be back to us again on Friday of this week. Nationwide, we almost certainly will not reopen in every state across the country at this point. We will, however, in New England, it is the intent of our 6 state coordinators and at least some of the volunteers in each of those states. We intend to open at least partially in each of the New England states. In Massachusetts specifically, while all volunteers will not return, we do anticipate opening a significant number of sites. Sites to reopen will need to meet a series of conditions that we'll impose, and also a series of conditions that we anticipate the host sites will impose. I would comment just for people generally, to the extent that I've seen host sites conditions, they tend to look very similar to the conditions I anticipate we'll impose, so that I don't think that there'll be an awful lot of conflict in differing conditions. And in many cases, our plans are going to adapt based on the host site operation. For example, I know a number of the senior centers in Massachusetts are looking at screening and requiring masks. To the extent they do that, we'll be happy to have them doing that and just adopt to their criteria, rather than putting in our own separate requirements for masks or a different screening process. In general, to get forward, I anticipate that each local coordinator for us will be required to submit a reopening plan. In the package that we sent to the AARP leadership and the IRS a week ago, we had a number of model reopening plans. Our intent being, although again it's not yet approved, that to the extent the site's plan largely follows one of the model plans, that the reapproval will be very quick. It's my hope that it will be delegated to me, and to the extent it's delegated to me with our state coordinators, to the extent they review them, I anticipate it to be a very quick process. I mean, talking, like a day here kind of process with both the state coordinator and I, if they have an aligned plan. One element that I would assume that you would all want, but that we will impose in ours, is after we operate a new site, we're going to evaluate it after a couple of days to make sure it's operating in a way we like, or we need to adapt it. And I assume you all will be doing the same things. This is things like, to the extent we have a local distancing model, is it working, or are people starting to wander, and break that down? And if so, what actions do we need to take to fix those kinds of things? So that's the broad outline. I hope that we can give you something definitive, certainly by your next meeting, and Joan will communicate it if it's a significant time before your next meeting to the MCOA. And the second we have the ability to go, we'll be having our local coordinators talking to their host sites. I will comment, the only potential issue I've seen in any of the host site plans is potentially restricting the site to only residents of their town. We do see that as an issue, and to the extent that in many cases, with a limited number of volunteers coming back, we'll be opening one of several sites in an area. And to that extent, particularly people who had appointments before, we feel strongly the need to accommodate them. And so that's something we'll need to work out. That is something that both our federal grant and the non-discrimination policies of the IRS would make it very difficult for us to live with. So those are kind of the points that I have, and I'd be happy to take any questions David or others have from my comments here.
I think this could be a learning process for all of us. I really appreciate the fact that John and Joan and the National have built in a review after a couple of days, because I think that's critical. I think it'll also help inform us about reopening, because it's not just going to be the ARP Tax Foundation. We're going to be needing to get people on food stamps and needing to help people with medical insurance. And these are the kind of things that senior centers normally do. And what we can learn through this experience, the first week or two or three of those volunteers coming on site, and how we can properly social distance, sanitize, wear masks, etc., will help inform how we reopen the rest of the senior center and the other programs that are so vital to older adults in our Commonwealth. So I think we all need to keep an eye on this. I think we need to be positive about this. John and I have talked about this over the years as well, regarding the regionalization of this particular program. And if your town says nobody from outside the town can come into your senior center, that will be preclude the foundation from being able to cite the tax program at your center, because they are governed by regulations that say that they have to be open to Massachusetts residents, and they don't have control over that. So if your town says only people from this town can come into this building at this time, that might opt you out. And you just need to be aware of that as part of the discussions that you'll have with your Board of Public Health and with your town manager. But that are the kind of things that you can start processing now. If you've been a host in the past, you need to call your manager up after you get off of this phone call and say, hey, this is what's coming down. Are you comfortable with the fact that we are a regional site, not just a local site? Did I reflect that well, John?
I think that was very well said.
Anything else from Mike, John, or Joan at this point in time? Well, personally, I think the new reality, I don't like it. I'd like to go back the way things were, but I really appreciate the flexibility that your team has shown, Mike and John and Joan, and we hope that we can get this program off to help as many older adults as we can. We know we have waiting lists and people who had previously signed up, and let's see how many of those we can get through. And especially, as Joan pointed out, make sure that we get through the ones that may owe taxes only because we want to make sure that they get theirs in a timely manner. And if we can triage some of those out, given that we're going to have fewer volunteers and possibly fewer sites, we will deal with that. But thank you to John, Mike, and Joan, and we'll wait for you to hopefully get us a green light from National as soon as possible so we can start doing it. But in the meantime, those directors who have been host sites, you have your homework. I would suggest that you get that accomplished in the very near future.
Thank you, David, and thank you for giving us the time on the agenda and for all the work that each and every one of you are doing on behalf of the seniors of your communities and older adults in general. So take care, stay safe, be well, and John and Joan, thanks again for joining us.
Okay,
Have a good day. Thanks, David.
Moving on in the agenda, thanks to our folks from ARP, but moving on in the agenda, as you all know, as members of MCOA know, we had 3 major task forces. We had several minor ones that were doing quick work, but we had 3 major ones. We were just speaking about the reopening task force that presented last week. The week before that, we had Joanne Moore and Susan McNulty from our staff presenting on the online programming. They've also made progress that in the coming weeks we'll get some updates on. But the 3rd task force was our online programming for our professional development. As you all know, all of our professional series of trainings have moved online, and we will be doing no on-site trainings between now and the winter holidays because of the COVID outbreak. So everything will be online in either a Zoom format or another format similar to that, and we have taken steps to prepare for that. I want to turn it over to Kathy and to Kelly, who will be addressing this and giving you the current updates. Kathy, I think you're first up.
I am. Thanks, Dave. And thank you, everyone, for calling in this afternoon. The task force met yesterday, and we wanted to give you a heads up. One of our first activities is to conduct a survey, and we're going to have the survey in the briefs next week. And we also are going to be asking a question about training needs and interests at the regional meetings over the next couple of weeks. So if folks have ideas and suggestions on what they'd like to see, please send them to us. And if you want to email me, you're certainly welcome to do that as well. We have a lot of things that are actually going on already, and all staff has been integral in the involvement in the trainings that have been scheduled. And I wanted to remind people that not only are they posted in briefs on Tuesdays, but they're also posted on the website. So please check those out. And some examples of some upcoming trainings. Kelly is managing the Small and Rural Conference, which is coming up the end of June, and she'll be talking about in a couple of minutes, as well as a transportation forum. Susan Karp is working on a volunteer forum. Tara is working on a nutrition forum, and Patty and Lynn are working on a whole series of technology training that they are continuing to build and evolve as people are identifying needs. So please offer your suggestions, and we're here to certainly try to meet those needs as best we can. And just so you know, coming up, we have some trainings that are in the process of being developed. We have a campaign finance taping that's happening next week. We have a continuation of the Welcoming Place project. We have a video that's being developed with that for tips. And also Cater with Boston University is working with us to develop an online training for support group facilitation. So look for that coming up in July. I also wanted to talk with you a couple of minutes about the fall conference. That is scheduled virtually from October 19th through 23rd, and it's going to be held from 1 to 4 in the afternoon. Our format is each day we're going to have an introduction or a keynote. We will have a series of workshops, and most of them will be taped. And we'll have some round tables, and we're hoping to have some fun too. This is an evolving situation, and certainly any suggestions that you have, we're certainly welcome. We certainly welcome them. The call for presentation is now posted on the website with a due date back of early July. So if you're interested in presenting, please fill out the form online. And also, if people are looking for topics or have suggestions on potential speakers, please let us know. This is a new world for us, and we're hoping that you'll come along with us for the ride. We also plan on having some vendors and sponsorships, as we usually do at the conference, and that those decision making will be happening as we move closer to the conference. So that's all I have to report. And Kelly, I will turn the microphone over to you.
Thanks, Kathy. Just wanted to add to what Kathy was talking about. The call for presentations, if you go to MCOA's website, go to the training tab and pull down the menu to the 2020 conference. And that is, the call for presentation is not only for the fall conference, because as David said, we are doing most, if not all of our trainings now virtually. So we have quarterly membership meetings and trainings for working groups focusing on COA staff conducting outreach, volunteer recruitment, supportive day, activities, programming, wellness, and more. So we invite you to share your expertise with our network. As I know from over 20 years of being a director in a couple of senior centers, my peers had the greatest information and always like to share. And so I encourage you to do so for that. Or if you know someone that would like to share their expertise with us, we are definitely looking for that. Secondly, Kathy touched upon the program meetings that are going to be starting up next week. The first is a transportation program meeting, June 3rd, 1 to 2:30, and that's on Wednesday. Again, to get more information for that and to register, please go to our tab for training and the pull down menu to those trainings. The transportation program meeting will have 3 speakers: Rachel Fichtenbaum from Mass Mobility, Michelle Alex from the RMV, and Maria Foster from the Transportation Resources Information Planning and Partnership for Seniors out of the Brookline Council on Aging. Rachel's going to share some resources to assist councils on aging in thinking about transportation and COVID-19, and also will be sharing some grant opportunities. Maria will be talking about the TRIPS program and how you may get some training on that virtually, and also some alternative transportation options for older adults. Michelle has a lot of updates about policies that have changed in light of COVID-19 at the RMV. And she'll be sharing those and provide an overview of the 40+ transactions that can be done online with the RMV. The week after, on June 10th from 1 to 2:30, my colleague Susan Karp and I will be talking about volunteer coordinators. Again, Susan has set up 3 great speakers. Doug Dixon, who's the co-founder and chair of Encore Boston Network, will speak on Experience Matters, strategies for attracting and energizing volunteers 50+. Ruth Lindsay, the RSVP coordinator of the North Shore, will focus on how the RSVP works and highlighting collaborative agencies with that and how to provide resources to connect with other senior core programs. And lastly, Bill Murphy, who is a retired COA volunteer coordinator, will talk about his creation of Coffee and Conversation and gathering volunteers to share experience with other volunteers. The third in our lineup is going to be a presentation by our colleague Tara Hammis, who is known as our favorite registered dietitian. And Tara is going to talk about an overview of malnutrition, online links to food system, and also how to identify resources in your community. It's all part of MCOA's new nutrition toolkit. And lastly, the Small and Rural Conference that Kathy mentioned is going to be held on June 30th. It's a Tuesday from 10 to 3. And we had, in the past, we wanted to offer that on April 30th, but of course, COVID-19 got in the way. So now we're offering it virtually on June 30th. It's at a great price. It's $20 per Council on Aging or Senior Center. And for billing purposes, when you sign up for that, sign up all of your staff with their emails, and it will be $20 for all members of your senior center. Again, that's under trainings on the website. And we have a great lineup of wonderful speakers for that. And it'll be 3 sessions for a total of 10 workshops. So I know everyone will really enjoy that and learn a lot. And thank you very much. We're looking forward to seeing you at our trainings.
Kelly, just to clarify, it is $20 per center, not $20 per individual.
I'm sorry if I said that. That's exactly.
No, I wanted to make sure it was very clear. So
yes.
Each town can sign up for the $20, and then you can get several of your staff people or board people to join us. We welcome people to get on board. And again, this will be done through a Zoom type of a format. Those who can't access a camera, who can't be on that, you'll be able to call in as well and listen to the trainings. But again, as we move towards this online experience of programming, it's something the members have been asking about for several years, but necessity is obviously the mother of ingenuity, and we've learned how to do this as a association. And we hope that these experiences, we learn and inform each of these as we move forward. So what we're going to learn from the Small and Rural Conference will inform how we conduct the Fall Conference. I also remind many of you are aware that the National Council on Aging is doing their virtual conference the second week in June, that Monday, Tuesday, Wednesday. You can find their stuff on ncoa.org and get some updates if you haven't signed up for that as well. But we want to learn from them as well. And I was talking to Maureen O'Leary this morning, and again, what they learn from their workshops and how business can be conducted will help inform Kathy and Kelly and Becky and Jody and Terry as they move forward in terms of setting up our October experience as well. So thank you to our online programming for professional development task force. Big words, lots of titles. We can't come up with an acronym for that quite yet. But we really appreciate the efforts that you guys have put forward. I think it's going to show, and I'm really looking forward to a lot of these trainings. I thank those presenters, Patty and Lynn and the rest who have been doing these trainings up until now, and Sue and Kelly and the ones that will be coming with Tara in the month of June. But I think this is driven by membership need, and I appreciate the opportunity. I turn it back now to Betsy.
Thanks, David. We're going to move into the weekly Q&A session. And again, these are bucketed into areas. And the first area of questions is related to reopening. And David, these are actually going to be directed towards you. But before I ask the question, I did want to provide a brief update in regards to the task force on reopening that is meeting tomorrow. And we're anticipating finalizing the considerations guidance. And if that is approved tomorrow, as soon as that's approved, we will get that on our website and let you know about that. If there aren't further any large edits or amendments that have to be made to that, we're hoping to post it tomorrow, if not on Monday. But we will notify everybody that that is up, and we'll be providing the structure on our website in terms of guidance moving forward. So David, to get to that first question relative to reopening, the question was, is anyone considering opening their center this summer?
First, I want to thank the folks on the reopening task force. I've already seen the preliminary report and it's tremendous. And as I mentioned, the students, the staff, the board members who have participated, thank you. I think there's going to be great resources in there for you guys to look at so you can consider reopening. The first question, considering reopening, the answer should be, everybody should be thinking about reopening. That doesn't mean you're actually going to be opening the doors, but you should begin thinking about using the tools that we're posting, how that reopening will look. Start doing the homework now. So when you consider reopening, you should be doing the homework, checking out the protocols, doing your inventories, walking around with a 6-foot dowel or whatever it takes for your team to get the mindset of what this will look like. Where are the sanitation systems going to be? Where are there going to be masks for somebody who shows up without a mask? Those are the kind of considerations that you need to be able to start talking through with your teams now. So when the green light is given, or even the yellow caution light is given, that we can begin to reopen. I would also suggest that you'll be thinking about it as I mentioned earlier, we're not reopening everything all at once. We are going to be reopening maybe small group meetings first, and that a congregate nutrition site will be further down the way. So those are the kind of things that you need to be thinking about in terms of the amount of people and how this happens. So do we know specific who's reopening at this point in time? No, because again, the governor's executive orders are still in place, and that executive orders say that 10 or more is prohibited, and that over the age of 65 and people with underlying conditions should stay at home. So keeping that in mind, I would suggest that if you're thinking about this, just to check with your local Board of Health, because there is an executive order in place that precedes what you might wish to do or might be able to do. You do have to follow the governor's order.
Thank you, David. And there's another question relative to reopening, but it falls under transportation. And if you'd like me to take this, I certainly can, because the reopening task force is looking at transportation. But the question—
Please do. And just for the people who, unfortunately, I'm sorry, heard my dog in the background. My dog does not have COVID. He is just an older dog that has a bad cough. So my apologies for the background noise there. But again, the task force took specifically a look at van usage and transportation, and I turn it back to Betsy for an early report on that.
Great. Thank you, David. Yes, we are separating out transportation, restarting your transportation from, opening your senior center and restarting programs. So you're going to see information on that as well. And we also received some resources from EOEA last week that we'll be posting along with that. So please be on the lookout for that. That'll be—
and just a reminder, again, we're hosting a transportation forum next week that Kelly was just alluding to. Sign up for that, because there will be opportunities to hear what the current state thinking is with COVID and transportation. And that forum is developed for this. So please not only look at the recommendations that Betsy and her team will be posting, but come and join us at that forum.
Yes, please do so. The next question still falls under the bucket of reopening, and this one is really for Carol. So Carol, if you want to respond to this question, the question is, many town administrators have asked COA directors for clarification of when the state guidelines for senior centers will be released. Some COA directors thought information might be released this week, and others thought next week. We understand this is a cumbersome project, but would you please clarify when we can expect to receive this information?
Thank you, Betsy, and thank you, everyone. It's a pleasure to be here again. These weeks go by fast for sure. My best guidance that I can give to all is to refer to the governor's reopening plan. That is at www.mass.gov. Info details reopening 4-phase approach. There aren't specific guidance or guidelines in place yet for councils on aging or senior centers. And as soon as Elder Affairs is made aware of that, we will certainly share that with MCOA and all of you. I would say that there's lots of talk out there and lots of rumors and, you know, expectations that there is, you know, guidance or more information is going to become available and it's happening on this day or that date. And that's so hard to hone in and control lots of the chatter. I will say that I am on calls. Many of my colleagues at Elder Affairs are on calls regularly with folks from the governor's office, with MEMA, with Health and Human Services, and we get information and we share that information. In fact, today I was on a call with Lieutenant Governor Karen Polito, and she talked a little bit about the various phases. It is consistent with what the governor has shared right along, and they are very actively working on providing guidance as we move into phase 2. We're still in phase 1, and as David has shared a few times on these calls and reiterated today, that senior centers are a little further out. So I would not necessarily expect that there would be guidance coming in the next week or two specifically for senior centers, as the governor and his team are working on phase 2, which includes daycare and childcare and campgrounds and restaurants, retail, and lodging, all very complicated. I think in terms of planning from your end and the guidance that I've heard on this call, and very excited to hear from the task force on reopening and what guidelines are recommended in that. I think also just going again, I know I sound like a broken record, but to look again at that website and look at the guidance and the specifics that are already in place there for various sectors, because much of that will apply to senior centers as well. You're doing that inventorying now, you're looking at sanitation systems, you're thinking about those touch points and surfaces and how will you gather groups safely, what about PPE, all of those things are crossover to many other sectors. So if you are looking at your sites, as I know you are, and you're trying to figure out this planning and you don't have an actual document in your hand yet from the state that says you need to do X, there is a lot of information out there that is applicable to you and I think could be helpful in your planning. I will send the link again to you, Betsy, so that it can be posted on MCOA online.
Great. Thank you very much, Carol. Moving on to the next category, which is programmatic. And again, this question will be for Carol. The question was, I listened to the Tuesday advisory and heard SNAP recipients will be able to use online at Walmart and Amazon. I did not hear a date on any guidance as to how this will be done. Is there any written protocol for this process?
That's a great question. And I reached out to my colleagues at the Department of Transitional Assistance who oversee the SNAP program. Obviously, this is something we want to know as well. We've received a lot of inquiries around this question. So as soon as I hear back from them, I will provide the information to Betsy and team and get that information to you.
Great, thank you very much. And I also want to remind folks that MCOA will have, through Tara, will have a update in the nutrition, our nutrition update tomorrow. So moving forward to the next section on programmatic items. This question actually I think was for David. The question is, now that many of our senior centers are offering virtual programs such as air yoga, falls prevention, strength and conditioning classes, if we use formula grant funds to pay for the instructor, do we need to continue to ask for donations? And if so, is just mentioning donations are appreciated or a suggested donation of $2 per class sufficient? We were thinking of announcing it at the beginning of virtual classes and or in the email when sending out Zoom invitations that participants that may want to donate can send their donation to the Council on Aging or Senior Center.
In this time of COVID response, I think that you certainly can ask for donations. I would hope that people recognize that there are costs attached with the classes that we're talking about, and that we hope that people would help offset that class with their individual donations. And I think, as this question outlined, there are ways that you can do that and should do that. And yes, I would continue to ask for participants to contribute to the overall cost of your programs.
Great, thank you very much. We're moving on to the last question, which falls under the category of health and safety. And so, Carol, I'm going to ask you, I'm going to toss this to you. The question was, I would hope clarified from the governor's report, which stated people over the age of 65 and those who have underlying health conditions should continue to stay at home. On last week's call, I think it was stated that people over 65 with underlying health conditions should continue to stay at home, only going out for essential errands, etc. I think it's important for seniors not to think if you don't have an underlying health condition, you're cleared to go out to the hair salon, etc.
Thank you, Betsy. And I am going to refer to the governor's reopening phase, his various phases, and he does have on that site, it's very helpful, it's called Safer at Home Advisory, and David did reference this earlier, and I will read that advisory to you. And this is what I shared on our call last week. Effective today, which was May 18th, the Department of Public Health also updated the Stay at Home Advisory, replacing it with a new Safer at Home Advisory. The new Safer at Home Advisory instructs everyone to stay home unless they are headed to a newly opened facility or activity. It also advises those over the age of 65 and those with underlying health conditions to stay home with the exception of trips required for healthcare, groceries, or that are otherwise absolutely necessary. All residents must continue to wear a face covering in public when social distancing is not possible, and individuals are advised to wash their hands frequently and be vigilant in monitoring for symptoms. Restrictions on gatherings of more than 10 people remain in effect. So that advisory is posted at Safer at Home Advisory at the www.mass.gov reopening, and I think it's pretty clear for that guidance on folks who are 65 and those with underlying health conditions to use precautions.
Great. Thank you very much, Carol, for that. Dave?
And can I add, Betsy, while we're on the call, I did hear from my colleague at the Department of Transitional Assistance. She just responded back and said that DTA is currently working with both Amazon and Walmart to get things in place. So that's as much as that they are able to share now. I do not have a date, but at least we know they are having those conversations, and as soon as more information is made available, I'll certainly share.
Fantastic. Thank you, Carol.
Welcome.
David, I'm going to toss it back to you for closing. Those were our questions for the day.
Again, thank you all for participating. And I just want to say one more time, and I know, as Carol says, we sound like broken records, but it is so much easier dealing with this pandemic when you're working with people like Carol and Emmett and Adam and Robin and the secretaries and the governor's office, because they are responsive, they have been helping, they have been proven leadership in terms of helping us understand where this COVID virus is going to impact our older adults. Right now, there's 1.7 million older adults in our Commonwealth, and we want to keep them as safe as possible. So as you begin to think about next week, think about the homework that you just got. Again, taking that inventory within your senior center, taking that of the different programs, the different formal and informal programs that you offer. Think about those things that you need to be able to do to reopen, and work through the protocols and the recommendations that'll be established and online. Take a look at some of the local ones that we've already posted that some of your colleagues had set up for their communities. And may I just simply give you one more suggestion? which is maybe you set up a task force within your own senior center. Maybe you have a board member on there. Maybe you have a consumer on there. Maybe you have a couple of staff people, just to work through the documents that you have in front of you, or you will have in front of you, and to answer those questions. Because we all see things through a different lens, and we want to make sure that our centers are as safe as possible, and having a few people take a look at those particular questions or procedures or protocols that are listed there, recommendations, I think would be helpful to have a fuller spectrum of response. So may I suggest that that is something you could do locally? It is something that would be part of your homework that you would be able to establish over the next couple of weeks. And you then could create that written plan for when the governor does move us into the phase that would allow senior centers to open, when he would allow people with over the age of 65 to move freely within our communities, that we are there on that day to be able to provide the services that are so valuable and so necessary. And we hope that you have those plans in place for that date. In the meantime, please enjoy the rest of the week and stay healthy.
Thank you very much. And again, thank everybody for dialing in today. We really appreciate it. Keep your questions coming to coronavirus@mcoaonline.com. And we will talk to you next week. Stay safe and well, everyone. Take care.
Thank you. Bye.